Good morning, everybody. Good Monday morning, everyone. Thanks for joining us with for Medicare Monday with Indiana SHIP, the State Health Insurance Assistance Program, where we help people understand Medicare and all the related insurance products. I'm Susan in Indianapolis, and I'm joined by my coworker and friend, Megan Rogers, up in the northern part of the state. Good morning, Megan.
Good morning, Susan.
Well, we're excited to hear your topic this morning. Megan's put together a terrific presentation about the explanation of benefits, EOB, and the Medicare Summary Notice, MSN. We like abbreviations
We sure
in
do.
the government, just to confuse people.
Yep.
Those things you get in the mail that say this is not a bill that look exactly like a bill? Well, Megan's going to clear us up on that and really what you should be paying attention to and explain all that stuff. So thanks, Megan, and you can take it away.
Wonderful. Thank you, Susan. Let me get my slides here and we will get going. All right. So we have, as Susan said, we have Medicare summary notices and we have explanation of benefits. Guess what? They're the same thing, same exact thing. They're called two different things and the forms will look a little bit different, but they're the exact same thing. The intent, the purpose, everything is the same. So the Medicare summary notices here on the left, you receive those when you're on original Medicare, when you have Part A and Part B through the U.S. government. On the right here, we have our explanation of benefits. You receive those when you're on an Advantage plan, when a private insurance company manages your Medicare benefits. And we also hear those called Part C plans. You also get an explanation of benefits when you're on a Part D drug plan. So if you're getting your medication through a standalone Part D plan, you'll get an explanation of benefits. So both of these forms provide a detailed summary of the healthcare services you received and the Medicare payment. So what is Medicare paying? What might you owe? Did they deny anything? All that fun stuff. They're going to show all the services or the supplies that were billed to Medicare during a 4-month period. Now, this is specific to the Medicare summary notices. You get those every 3 months. Explanation of benefits, you generally get those monthly. It's going to show again what Medicare paid and then the maximum amount you may owe the provider. And we'll talk about that a little bit more when we actually look at samples of these forms. And then, like I said, you're going to get the MSNs every 3 months if you did go see a doctor or had medical care during those 3 months. Now, you can actually get these online if you have a My Medicare account through Medicare.gov. So you're either going to get them in the mail or you'll get them online. And we're actually going to look at copies of the online version. And then if you are on original Medicare, the Medicare summary notices for Part A will detail the inpatient services, and your Part B will detail the outpatient healthcare services. And if you have any questions for me as we go along, chat those in the chat box, and Susan will monitor that. All right, so this is a copy or sample of a Medicare summary notice that you will get in the mail. And this page is part of your Part A hospital notice. So it's going to have your name. It's going to have the logo for Centers for Medicare and Medicaid Services, I believe, or some official government thing. I can't read it, but it's some official government logo there. And like Susan said, it's going to say this is not a bill. It certainly looks like a bill, but it's not a bill. So this is just telling you what you had done. And Again, what Medicare paid, if it denied anything, what it approved, and what you may owe. So it's going to give your Medicare number, it's going to give the date of this notice, and then the claims. So it's going to give the date range. And then it's going to tell you right over here, did Medicare approve all the claims? It's going to say yes or no. So for Jennifer Washington, for June to September, it did pay all of her claims. Now, when you're on Part A and Part B, you may owe deductibles. So it's going to tell us if Jennifer met her deductible or not. So for her Part A, she did meet her deductible for inpatient hospital services. Now, keep in mind that these summary notices are not going to recognize what you may have as secondary insurance. It's only going to recognize what it's covering, the Part A or the Part B. And we'll talk a little bit more about that when we get to the Part B notice, which I think is the next slide. It also tells us here what facilities made claims. So it's got the hospital here and the dates for that. All right, so the next slide, we're going to talk about our Part B. So this is a Part B claim. This is not the front page. When you get your Part B claim, it's going to have a front page cover, just like your Part A. So up here on all the pages, it's going to say this is not a bill. It's going to have your name. It is going to have some definitions for you. It's going to have your dates. This is the date that you went to see this doctor, and it's going to have the address and the facility's name. It's going to tell us if the service was approved. So this eye and medical examination was approved by Medicare. They paid $143. Medicare, well, hold on. The provider charged $143. Medicare paid $107 because no insurance company pays the full amount, whether that's employer coverage or Medicare or COBRA or whatever. You never see that they pay the full amount. So that's the approved amount, 107. Medicare paid 86, and your 20% is $21. So this other medical claim, destruction of skin growth, was not approved by Medicare. And that means that the provider charged $68, you have to pay $68. And then when they do deny a claim, they're going to have a letter here. And that is going to tell you why they denied it. And I couldn't find a sample of the denials, but it will come with a page that has the denial codes with the letters. And you can look for this code, this letter, and figure out why they denied it. It could be a billing code issue. It could just be simple mistake. So what you would generally do is you could always call the doctor's office to see if it was a billing code issue. You can also appeal. SHIP counselors can help with appeal issues or help guiding you if you don't understand from these Medicare summary notices why they denied something. All right, so this one is your explanation of benefits. So up here, it says explanation of benefits. So you're getting this directly from an insurance company. So your Advantage plan or your drug plan. Again, it's going to say not a bill. It's going to have a lot of the same info. It's just going to look different. All of these will look different specific to that insurance company. And they generally come monthly directly from that company. So it's going to say provider, your name, the date, the claim date received, claim number, date paid, service, provider charges, allowed charges, what you owe, total claim costs. So it's going to have all the same information that the Medicare summary notices did. It also tells you about paying your bills, keeping documentation, keeping the explanation of benefits, and appeal. So if you feel you need to appeal something, it kind of walks you through that. All right, so now we're going to look a little bit at the electronic copies of the Medicare summary notices. Now, I believe you can get the explanation of benefits electronic as well, but you would have to do that specifically with the insurance company you're on. So if you have a United Healthcare Advantage plan, you would go on their website and sign up for an account and sign up for electronic explanation of benefits. If you have a WellCare Part D plan, you would go to their website to sign up for an account and sign up for electronic explanation of benefits. So you would go to Medicare.gov, you would get a My Medicare account, and then there's lots of fun things you can do in there. You can pay your premiums, you can compare plans, you can see what plans you're listed as having, you can get a Medicare card if you've lost yours. You can actually see an electronic copy of your Medicare card. So you can also check your claims, which is basically your Medicare summary account or Medicare summary notice. If you are getting paper copies at the moment, you can go on here and you can get these MSNs electronically. So you would click this button to sign up for the electronic ones. Once you get those electronically, you can go here, check my claims. So we're going to look at a couple of the claims. Now, this is my father's account, so we're going to dig into his medical history. So, and there's nothing, I'm not sharing anything personal, so it's all good. So, just moving my camera here a little bit. So, it gives the month, the medical claim number, the date of the service, the provider. We can then click the button here to see more details of that claim, and we'll do that in a minute. One thing to note, and I kind of mentioned this earlier with the Medicare summary notices, and well, these are the same thing, they're just electronic. They do not recognize your secondary insurance. So they're going to show always that you have a copay. But if you have a supplement or you have Medicaid, then it's generally going to be covered. So you may not owe this copay, like my dad has Medicaid, so he's not going to owe this. Medicaid will be billed secondary once Medicare pays. So let's go to the next slide. Let's pretend that we hit that open claims details, and it's going to take us to this page. So it's basically got all this mumbo jumbo here. I'm not sure what's going on with this top amount here. But basically it breaks down everything for that provider and then shows what you might owe. Oh, here we go. So in his online account, it does indicate what he has. So he has original Medicare, he has a drug plan, he has Medicaid as a secondary, and that's all listed on his account. So they do know what he has. So it does list here your supplemental insurance, Humana, which is his Medicaid, might cover part or all of these charges. So even though they list it here, they do recognize, at least in this case for the Medicaid, that that might cover it. Susan, do you know if they recognize in the Medicare.gov the supplementals, the Medigaps, like they do the Medicaid? I can't remember.
I have seen that on people's Medicare.gov account,
Okay. Okay.
but
Then
I'm not sure if it's
okay.
reflected on their EOBs.
Okay.
Um,
Okay.
because I haven't seen as many of those, obviously, as I helped people set up their accounts.
Exactly, exactly. So just know, don't panic if you get those notices and you see that it says there's a coinsurance. It, Medicare generally is not going to recognize the secondary insurance. In some cases it might, but don't panic if it lists a copay. Just just keep these and be mindful. Um, mm, there's something I want to mention about providers, but I think I have it on another slide, so we'll wait a minute. Okay, so these are some other summary from his claims. So basically, it just is kind of listing a whole bunch of stuff he had, like he has no blood deductible, his physical therapy, there's no charges. Um, he sees a psychiatrist, there's no charges there. Occupational, there's no charges. There's a total amount here, 185. And then Medicare approved is 58. And I think this is from here, but quite honestly, now I don't remember what I was screenshotting, so bear with me on that. Just know that you can get a lot of details from the MSNs in the Medicare.gov site. All right, so let's talk about some key things to look at on these Medicare summary and explanation of benefits. You want to take note of the date of service. So if it says July 5th, did you actually go on July 5th? Was that the accurate date? Facility and provider. Did you go to that doctor or facility? Did you go there on the date listed? Now, this gets a little funky. Sometimes on these notices, the provider's name may not match. The facility's name may not match. So, what do I mean by that? So, providers. Sometimes, let's say you went to see a nurse practitioner. A lot of the time, they actually list on the Medicare summary notices or the explanation of benefits a main doctor from the facility and not necessarily the nurse practitioner you saw. That I have experienced with my dad with his claims in the nursing home. He sees a nurse practitioner a lot that comes to the facility, but they list another doctor instead. And I'm like, well, who the heck is this? Same with the facility. So the facility, the nursing home he's in, has, when you're a Medicare provider, you have a billing code. It's NPI. Again, we love our abbreviations. Basically, it's a Medicare billing code. I don't know what it stands for. So Susan, do you know what NPI stands for?
I do not.
Okay, that's fine. Just know there's something called an NPI. You may see that on some of the bills or the MSNs or the EOBs. So whatever that facility's NPI is registered under is what you're going to see as the facility's name. So my dad is in a facility called Southfield, but their NPI is Community of Bremen. They're attached to the Community of Bremen Hospital. So it gets kind of fun when you see that and you're like, well, he was never at Community of Bremen Hospital. It's because of what they're listed under as the provider. So just keep that in mind. So if you're kind of confused about why that name is on there, you're like, well, I didn't go there. You may want to call the doctor's office and see just to make sure. Maybe you already know that it's going to come up as a different name. Maybe it's going to be under a hospital system. Maybe you go to a hospital system or medical practice and you know that they're under like St. Joe Hospital and you already know that that's what it's going to be listed as. So just keep that in mind. It's not always going to match, but you do want to kind of research it to make sure it's appropriate. And in the next slide, we're going to explain why we want to make sure. Susan?
I did a quick Google search on MPI.
Oh, wonderful.
And
Thank
I
you.
just Googled Medicare MPI, and it
Okay.
says in the context of Medicare, it can refer to several things. The
Okay.
Medicare Policy Initiative, which is a project at Georgetown University, the Medicare Prescription Payment Plan, which is normally referred to as MP3, which is a payment option for
Okay.
your medication costs, or motion picture industry. And I don't think that's applicable
No.
to Medicare. It's for plans that have a Medicare Advantage option. And we
Hmm.
know that's what your dad has.
He
Uh,
doesn't have an Advantage plan.
oh, he doesn't.
No,
Okay.
he's on Original Medicare.
Oh, that's right. But the Humana is showing up for the Medicaid
That's for the
pathways.
Pathways
Gotcha.
Medicaid. Yep.
It could refer to Master Payment Index, which is a database used in healthcare systems.
That's
That seems
probably
to
what
be
it is.
pretty likely. So
Yeah.
MPI, Master Patient Index, a database used in healthcare.
Well, thank you for looking that up, Susan.
You're
We're
welcome.
all educated now.
I do love the Google.
Yep, me too. Thank you, Susan. All right. And then type of service. So if it says you had blood work, did you have blood work? If it said that you were at the doctor's office and it was your yearly physical, was it a yearly physical? Another example is my grandmother several years ago went to the hospital for pneumonia. She was there for a few days. When I got her MSN, it said she was in the ICU. She was never in the ICU. So of course, we followed up with that. It was a billing code issue. We got that corrected. And you do want to make sure that you correct that because of ICU is much more expensive than a regular room. So that changed what we owed and what Medicare owed. So that's an example of making sure they're all correct and that the type of service is correct. So let's talk about why you want to make sure this information is correct and why you're looking at these. So, you do want to make sure that you're looking at these to catch billing code errors quicker. So just like that example with my grandmother, she was never in the ICU. It was a simple billing code issue. There are about a million, trillion, billion billing codes out there. And I know that if that was my job, I would make a couple billing code boo-boos when I was typing because there's a lot of numbers and a lot of combinations. I know I couldn't do it. So, and Susan's over here laughing at me. But it's true. It's a true story. I couldn't do it. So I give grace to them, but it happens. So if you see that there's an issue with the MSNs, it could just be a simple billing code issue. You want to contact your provider's office and they can help with that. If you do struggle with them not wanting to help with that, you can call SHIP and we can try to help with that as well and intervene. So that's an easy fix. Another reason why you would want to look at these is to see, was your insurance billed? Maybe you don't even see a doctor's office or a x-ray or an MRI listed on your MSN or EOB. That might be why you keep getting a bill. So you would also want to contact the provider's office. Hey, did you bill Medicare? Oh, well, we don't have your insurance cards on file. Or, oh, no, we didn't do that. So I'm actually working with a client right now where she had a procedure done and the doctor's office did the prior approval and the insurance company said, yep, we'll pay it. We'll pay, or at least some of it. And now then the doctor's office is denying it. And because they're not billing the insurance company. So I'm helping the client do an appeal to the doctor's office for that one. Now, that's not going to be a common thing, but it is something that you do want to check and monitor. Now, this one I added onto the slides this weekend because this is something I just experienced. So as a caregiver, if you're reading these and monitoring these for a loved one, you might catch that a new medication or treatment is happening for your loved one that you didn't even know. I got a explanation of benefits for my father's Part D plan, and there was a medication on there, and it's a recent new thing, and I'm like, well, this is interesting. And it also explains why he's been having some behavior problems because it's a side effect of this medicine. And the nursing home never told me. So that's a fun thing. So it's not a common thing, but it is something that you may catch, and it can be helpful as a caregiver. And then here's the big one, Medicare fraud. You can look at these and see things that are being billed to Medicare that you never had done. So let's talk about that. Now it's story time with Megan. So before I get into story time, Susan, do we have any questions?
Not so far, but I'll just draw folks' attention to the chat where I put in some information about booklets that can be sent to you from our sister agency and partner, Senior Medicare Patrol, and their website so you can access those booklets.
Wonderful. Thank you, Susan. I appreciate you doing that. I sort of added a slide with their info and I forgot to. So thank you. All right. So we'll do story time. Sit back and drink your coffee or your tea. Susan's got hers. All right. So this is a story I tell whenever I talk about MSNs, EOBs, or fraud. So we have Hazel, and Hazel gets a phone call from someone. And the gentleman on the other line is like, oh, you know, Hazel, I can get you a wheelchair free of charge through Medicare. Hazel thinks, well, I don't really need a wheelchair, but it might be kind of fun to scoot around in my small apartment with this wheelchair. So sure, why not? I don't know anything. Let's go. So she gives this gentleman her Medicare number, and he says, okay, you'll get this wheelchair. Well, she never gets this wheelchair, and she, forgets about it. She really didn't need it anyways. Well, 2 years have passed now, okay? Hazel is now in the hospital. Hazel now needs a wheelchair. Doctor says, Hazel, you need a wheelchair. Hazel says, okay, that's fine by me. So a little bit later, the discharge planner, social worker, case manager, whatever they're called at the hospital, comes in and says, Hazel, we got this order from the doctor to get you a wheelchair, and I sent the order to our home health agency, and they billed Medicare, and they said they can't get you a wheelchair because Medicare is saying 2 years ago you got a wheelchair. And guess what, folks? You can only get a new wheelchair through Medicare every 5 years. Well, it's been 2. So Hazel starts thinking, she goes, oh, well, I may have talked to someone 2 years ago about getting a wheelchair, but he never sent me one. The social worker goes, well, did you give him your Medicare number? I sure did. Well, this is what happened. She gave him her Medicare number. What he did was build Medicare for a wheelchair, but he never sent Hazel the wheelchair because guess what? He didn't have a wheelchair. It was fraud. This is what they do. So, how does this relate to the Medicare summary notices and the explanation of benefits? If Hazel was looking at these statements, she may have realized or caught that there was a wheelchair billed to Medicare. Now, she most likely would have had a copay, depending on what her insurance was. But let's say she had Medicaid or a supplement, so she wouldn't have even seen a copay. They would have paid secondary. So she was looking at these notices. She may have seen, or maybe a family member would have seen or caught that this was billed and that she never received it. And she could have called Medicare and appealed this. Now, it's now been 2 years. She might be able to contact Medicare and try to do an appeal, but it's probably been too long. Um, so she now cannot get a wheelchair through Medicare. Now, there might be some other options, private pay, contacting area agency on aging for resources. But it this is one way to catch fraud and to catch it a lot quicker. So it's very important that you're looking at these to look for things that you really did not have or you didn't get done. Now, this is a severe example because for most things with Medicare, um, if let's say they bill an MRI, now you could very well get another MRI reasonably later on without it being affected. But durable medical equipment can be pretty strict with Medicare on when you can have another one. So just be mindful, make sure you're looking at these, following up on things that don't look right. Were you in the ICU? Did you really get a wheelchair or a walker or canes? Did you really go to that doctor? Looking for those billing codes, watching for fraud, following up on things. So yeah, that is my story. Susan, I think that's my presentation. Any comments, questions?
Not at this point. Thank you so much for all this great information. And, it is important that we all do our part to be responsible for paying what we need to pay and looking for mistakes. And like Megan said, many of these mistakes are just human error with coding. Many of them are. But sometimes, like the lady in Megan's story time, they are used for bad purposes, and it can really impact you when you're trying to get these services later on down the road. I know a lot of people with back braces, um, things like that, have experienced this here lately. So if you want to learn more about Medicare fraud, visit our friends on their website, the Senior Medicare Patrol. You can also check out our YouTube video where the guest is Barb Miller from SMP, and she talks about all different kinds of Medicare and other types of fraud. We did that, I believe, in January or February this year, so that'll be on our YouTube channel. And of course, if you have any questions about Medicare or services or possible fraud, you can always call us at SHIP. And there's our contact information on the slide. I also put it in the chat.
Thank you, Susan. Well, that is my presentation. So would you like to share what we have coming up in July and August and our special presentation in September?
That would be terrific. So we do have one more presentation in July, Medicare Monday, and we are going to talk about the 5 big time mistakes you can make with Medicare. There's probably more than 5, but we're going to talk about 5 that we see a lot of people making. And with a little education, they may be able to change their decisions. So join us at 10 o'clock Eastern Time right here on our Facebook page on Monday, July 28th. And then in August, we have a full lineup on Medicare Monday. Our special guest is Sharo Boyd. She works for the Social Security Administration, and she is going to talk to us about retirement benefits, spouse benefits, and survivor benefits. So tune in to that. I will tell you, every time I hear Sharo present information, I always learn something new. She's also going to show us all the things that we can do on the Social Security website. And of course, we know one of the things that SHIP counselors experience a lot with our Medicare clients is that's where they go to sign up for Medicare. So we'll take a look at their online services as well. Then on the 13th, we are going to be at the Indiana State Fair, and we'll check things out from there. And then Megan is going to take us on a field trip through our website so you can see how we track where all SHIP counselors will be doing presentations. And she'll show us where you can find the information about our events and probably several other topics as well. We do have a terrific website that's really easy to use, so we're going to check that out. And then following up, ending the month in August, our guest is Dennis Frick. He's an attorney and the director of the Senior Law Project, which is part of Indiana Legal Services. And he's going to talk to us about Medicaid as it relates to Medicare. There's been some changes, and Medicaid is in the news a lot these days. We're going to concentrate on how Medicaid works with Medicare and the changes for those folks. So we're always on here live, 10 a.m. Eastern time, so please join us. Then in September, you can mark this on your calendars and share this with your friends who might find it interesting. Megan and I are going to host a webinar, and this is a true webinar. It's not a Facebook Live. And we're going to talk about all the things you need to know if you are getting ready to pick up your Medicare benefits, or if you just, maybe you've been on Medicare for a few years, but you're really just not really sure what it covers or how it works. So this is going to be a thorough primer on Medicare and all of the choices therein. And this is going to be on September 18th in the evening, 6 p.m. Eastern time. And we use Eventbrite for registration. Now, of course, it's free, but Eventbrite is just the software that we use so we can track registrations. So it's not going to be on Facebook Live. So you'll have to go to Eventbrite. And once it's posted, then it is posted now. Megan is saying, no, it's not posted now. Okay.
Sorry, Susan. I was agreeing that you have to go to Eventbrite to register. I should have it up. My goal is this week, but it may be next week. I will have an event made in Facebook just for an event, but it will show you that you have to go to Eventbrite to register. So I will have that up soon for registration. It just isn't up quite yet.
Okay, so by the end of the month, it's safe to say you can go ahead and register on that. And then Eventbrite will send you reminders and the link to join us on the live webinar where you can ask us all your questions. It's just a way that you can be at home in the evening and understand and learn about Medicare. So feel free to share that with your friends too. And that wraps us up for the day. Thanks for your presentation, Megan. I always learn something with your presentations, and we appreciate it. We appreciate your information.
Thank you.
I will say, everybody stay cool, stay hydrated, and have a terrific week.